Hi team, how you all doing? So second live of the day for me today. One this morning and one this evening. So it's 9 o'clock UK time here, and we're just gonna bring in Dr. Stanley, who I think has just joined in, coming live from LA. Oh, hi Jan, how you doing? Jan from Germany there, right? Okay, so Kyle is here. Let's see if this works okay. Hopefully my wireless is doing all right. Hi Emma.
Good morning,
Hey,
or
buddy.
good. Well, I don't even know what time it is. The days all run together. It's 2 o'clock here.
How's it going?
I'm good. I'm doing my Revenant look,
I like it. I
more
like
like
it.
like the guy off the street instead of
Hobo.
yeah, the hobo
It's
life.
quite a strong beard.
Yeah, it's got a little bit of wisdom in it right
It
now. So
has. It has. It's got
yeah,
some salt and pepper going on there.
sure does. Yeah, yeah.
How have you been?
I've been pretty good, all things considered, I would say, besides the doom and gloom of, people being sick and the economy being in the toilet. This
Yeah.
time to relax has been kind of nice, and you and I both have such busy lives, and we're flying, and we have our families, and we have our offices, and we have, other businesses that I think when we can be limited, we
Yeah.
can focus, and it's nice.
Yeah. Forced restriction. So how long have you
Exactly.
been on lockdown for now then?
So for us, it's been 2 weeks.
Right.
Yeah.
And have they given you any sort of time frame on how long you can expect to be locked
I think
down
at,
for?
at least another 2 weeks, if not three.
Really?
So, yeah, I mean, we're basically planning on doing it for, I don't know, a month or more.
Yeah.
I think that's how, I think it'll take probably a month or two.
Yeah, because I
Me
mean,
not
London
being an
literally.
expert with anything.
Yeah, absolutely. I mean, and have they given any insight into how? I mean, what the other side of the curve will be? Because at the moment, we only just went into lockdown yesterday,
Yeah,
and there's obviously no discussion on when they've said for 3 weeks for now,
right.
which I think is a, sort of a hopeful projection.
Yeah, I would
Um,
agree.
but have they given any insight into what the other side of the curve looks like?
No, not really. And it's the same thing. Everyone's just kind of guessing. I'm like, well, let's start with 2, 3 weeks and let's see what happens.
Yeah.
Just recently, I think yesterday in LA, they shut down all parks and beaches
Oh, really?
because people were using it like, oh, spring break, let's go to the beach, let's go to the park. And
Yeah.
so now you can actually get a misdemeanor and, get fined if
Yeah.
you're out and about and too close to people.
Yeah, we're allowed to go for one jog a day, one exercise trip a day, which is
Yeah,
it's surreal, yeah. But I mean, I was really glad, to be honest, when they locked us down. I think in the
yeah,
UK, a lot of people have been sort of questioning why it's taken so long. I know, obviously, me and you are on various sort of group chats with international
right.
dentists, and
Yeah,
obviously, a lot of them have been locked down for even longer, both
yeah,
from Italy and those sort of
right.
countries, and China, obviously. And for me, I was thinking, why are we not locked down already when we had like 10 cases? Like,
I agree. Yeah, there was a conference that was happening in the Northwest in Seattle somewhere just a few weeks ago, and it was the only one that was still happening. And I was saying, why hasn't this one gotten canceled too? And I guess it turns out that maybe there was a dentist there that actually passed away from it. And they say he got it there, but who
really?
knows? Yeah.
Oh God.
But I went from being like very kind of YOLO about
Yeah,
it
I
early
know.
on. We had plans. We were supposed to be in Boston and Washington, D.C., and where else were we going to be?
Morocco, you went, yeah,
Seattle,
right,
or Morocco.
yeah,
And we were like, yeah, we're going, like we're gonna go. We're not gonna let this change our life. And then I've come the total opposite way now.
Yeah.
To where I'm like, we are not leaving our house for
Yeah.
multiple weeks.
I'm literally,
you know?
I've had exactly the same journey. Because
Yeah.
it's so difficult, right? Because you're taking stuff from such a variety of sources, and I think this is one of the things I wanted to talk about with you is what your sort of feelings are with the media now, both social and traditional. But I've been on such a roundabout trip with it where I'm trying to stay up. I'm always trying to look at the bright side and be optimistic. So I'm like, at the beginning, I was like, I'm sure it's just like the flu. It'll be fine. It's not a big deal. And then as you see more and more coming through, you're like, oh my God, this is really, really, really serious.
Yeah.
And then like you almost become a bit, you start sort of preaching about it because you realize that everyone else doesn't realize that it's serious.
Right. They're
really
a week behind how you were, right?
Yeah.
They're how you felt 3
and we're
days
scientists.
ago.
Like we should.
Yeah. Right.
Like we think we know about not any of sort of medical necessarily, but we at least can process data and look at studies and look at the information. But
right. Yeah.
It's been a weird ride.
Yeah, I don't know who I really trust now. You know, the thing that I think really changed it for me was a few days ago. I talked to one of my friends who's a foot and ankle surgeon at a hospital, and he told me, he's like, if we don't get any aid in 2 weeks, we're going to be out of all PPE. We're not going to have masks. We're not going to have gloves. We're not going to have anything. And I was like, whoa, that's gnarly. Yeah. And so he does like a lot of amputations of feet and diabetic people and stuff. And he said they're doing amputations in like outpatient clinics because they don't want to bring the patients to the hospital. Yeah. So that's wild.
Yeah, no, I think that was probably the same thing for me. I've got a few friends who are doctors, and there was this one doctor, A&E doctor, like who's been in the game for 25 years, who he was on the radio the other day, and like 50-year-old man sort of breaking down into tears in sort of explaining the scenes that he's seen. And he's an A&E. He's an A&E consultant. I mean, he deals with the roughest of sort of presentation of patient situations, and I think that's really important.
Yeah. So one thing I talked about on one of my IG lives a few days ago was everybody's financial position in the dental world, and how that is maybe causing even more stress for a lot of us.
Yeah,
I know that, I think one thing that is a little bit different between our countries is that most of your guys' dental school is public, right? As far as or free, I should say, maybe not public, but free.
Our dental schools?
Yeah.
No, we pay tuition fees.
You do pay tuition. What's like a rough tuition fee for dental school, all in everything?
Meg, what did you come out with from your?
It's more now. It's like 9,000 a year now.
I think it's £9,000 a year now.
It's 3.
That's a small amount compared to yours, yeah.
That's amazing. Yeah, so I came out with $500,000.
Oh my God.
Yeah. So that's a big stressor for a lot of Americans. So the average dental student in the U.S. comes out with $278,000 in student loan debt. And that's whether that is, undergrad and dental school or just dental school, whatever, but that's the average. So
I had no idea.
It's a big monthly payment that many of us are struggling with.
Still paying with,
Yeah. So I think
the government giving any help on that?
No, right now the banks are actually allowing us to defer it. So we can defer it for 2 to 3 months. There may be some other options. It still accrues interest, but it saves us on those big payments because some of us have like a $4,000 a month payment, and that's post-tax money.
Just on that, yeah,
just on that. That's not including
how big it was.
That's not including like practice loan or home loan or car loan, or we're also loaned out. Yeah.
Well, that's the problem. I think I watch a lot of Gary Vee stuff, and he's talked about that quite a lot, about the sort of college debt, student debt crisis. And I guess I didn't really realize how much of a problem that was, because he was linking that in with sort of future recessions and all of that sort of thing. And I didn't really understand that, but that's amazing.
I think it's true. And every year the tuition goes up, goes up and up and up. My students now, after being out for 10 years, will graduate with much more than what I graduated with,
Really?
as far as loan. Same education, but more loan. Definitely going over what inflation is.
Yeah.
So that's a big stressor at this
Yeah,
point.
I mean, definitely. I mean, I've obviously, I don't know if you saw my video I put out on when I shut my practice on Sunday. But I thought I did really well in not crying during that, to be honest. Even though I cried a lot that day, and everyone messaged saying you were clearly very emotional. And I was like, you got no idea. I mean, it's just in the video I sent to all my team. But it was, I mean, it was a very, very sad day, and I kind of made the decision to close before
it was recommended.
Before we were recommended, I mean, our chief dental officer was sort of at that point saying to sort of not do aerosol procedures, but to carry on with routine dentistry on non-vulnerable individuals.
Right.
That was sort of the what I took from their guidance. But I don't know, I just felt that with the way things were growing, and I think with the constant feed that I get through on our international it's just I was just reading that every night and just thinking, this is not right. Like I'm risking lives for things that can wait in real terms in comparison to what's going on.
So we know that this is going to cause much more stress in our profession, right? And you and I are both big. We like to talk about this topic and be open with our own internal struggles with this. What do you think is the positive that comes out of this? Because I know my opinion, but I'll let you talk first.
So I really like this topic because I'm always looking for the positivity in things, and I think it's important to caveat this with this is the worst thing that's ever happened to the world. It is so atrociously devastating in so many ways, and I mean the negative impact it's going to have on so many people's lives is astronomical. But yes, looking for the positives, I think I don't know. I read something from Bill Gates this morning, and he listed out 10 that he had or 11 I think that he had sort of seen. And as you mentioned right at the start, for the whole world, I mean, there's a lot wrong with the way that we live as a society in 2020. Whether it be being overly materialistic, whether it being valuing celebrity over ethics, whether it be the impact that we're having detrimentally on the environment. And I think we're being forced by restriction of the virus to focus back on what's most important. Focus on our family, focus on our own mental health, focus on the things that are actually really important. And certainly for me, I'm always moaning to Megan, my wife, that I'm too busy and I've got this to do, I've got that to do. And obviously at the moment there's a lot to do with just sort of shutting down the practice, but I'm spending a lot more time with my little girl. I'm meditating every day without fail. I'm exercising more. I can play my guitar, which I can never do normally. These are all really positive things out of a horrible situation. But I mean, that's what I'm trying to focus on, and I guess that's what I'm trying to post the most about on my socials, because hopefully that will inspire other people to look for the positives in it as well. Because it's very easy to focus on the negatives, especially if you watch the news. How about you? You've been in. Well, I'm only 2 days in. You're 2 weeks in, so I might.
You got something to learn, right? I'll teach you something.
I'm gonna grow. I've got a lot of facial hair to grow in 2 weeks.
Yeah, that's true. Yeah. You'll look like me in 2 weeks. Hair will be super long, shaggy. Well, before I do that, I'm going to answer this question. Do you think this virus will change dentistry as we know it in the long run?
Yeah, that's Marcus.
I do. In my opinion, is that what it's going to do, for good or bad, is it's going to separate the very high end and the very low end. and this has always been my opinion with DSOs coming in,
Yeah.
is that it's that central market that is kind of like people doing good work, honest dentists that, you know, aren't doing the absolute best, let's say, but they're not running through things really fast. And I think this is like how my dad's practice was very kind of like normal practice. He did good work. You know, everything wasn't the absolute highest you could possibly be, the most aesthetic, but it wasn't, you know, a mill.
Yeah.
And I think what this is going to do is separate this out more to where you're, for good or bad, the offices that are going to handle this are going to be the super high end, out of network, no insurance, cash, you know, rubber dam, slow dentistry, and then there's going to be DSOs, very fast, very cheap.
Yeah.
That's my opinion. But what do you
Yeah,
think
I
on
think
that question?
Miguel, obviously, Miguel Stanley's slow dentistry network is something that we're both part of, and I think he has really sort of come out at the front on this one.
Yeah.
And I think it's going to become more and more important. I think patients are going to be much more aware on cross-infection, and I think all of us are in everything that we do. I hope that it doesn't lead to a lot more OCD and that sort of thing.
I know, right?
I fear that it might do, and a lot more sort of anxiety. I guess my biggest fear, from a social point of view, is that it leads to more separation and division. I guess.
I agree. I think
bringing everyone together.
Everyone may get so used to this whole, like, I just stay in my house all day and we do everything remotely, that, you know, that's already happened a little bit, but even more could be, I think, worse for society, and missing that really interpersonal relationship, you know, hugging your friends, touching your friends, being with your family.
Yeah, I'm a big hugger.
Stuff. Yeah, same.
Well, we hugged when we met.
That's true. Yeah, that's true. Naturally, we're drawn together. I think the positives, going back to the first question, the positives for me, similar to what you've been saying, is I think all the children in the world benefit from this, unless, of course, you know, they lose a family member or something. They lose a grandparent or a parent or something. But having both parents, or whether they have one or two parents, are you there? Okay, maybe they only have one parent, but now that parent can be home with them, and all of these children can have both of their parents home at the same time. I think is such a positive. Also for me, like what you were saying, I've been exercising every day. I've been in the sun exercising actually at the same time, and doing things around the house that I've been meaning to do for some like 5 years. Yeah. I mean, like, exactly. I cleaned the inside of my sliding doors that no one can see. But since the doors were open because it was sunny out, I looked and I said, oh my gosh, that's so dirty. I got out like a small little brush and cleaned everything.
Yeah. Did you have your loops on?
I didn't, because they're at my office and they're locked up. So darn. Yeah, that would have been nice.
I did see Matt Najad Sonic cleaning his watch the other day.
His watch, yeah. His big goal is to organize his house and his life. That's what he was telling me. Yeah. Him and I are doing some research right now, and I said, hey, let's work on that research. He said, hold on, I've got to clean my house first. I've got to get organized, and then we can do that research. So,
I mean, I think the thing is very difficult right now is, I'm really enjoying the opportunity to spend time doing bits and pieces that I haven't had the chance to do before, but I'm also, as I'm sure you are, very future driven and very sort of goal driven, right? Which I guess is linked a bit with anxiety anyway, because you're worrying about the future and you're pushing for the future. Right. But I can't make any goals or make any plans because I have no idea how long this is going to go on for.
It's so true, yeah. The only plans I've been making are these Instagram lives that I'm doing.
Yeah, exactly.
So
that's the difficult thing, I guess.
Yeah. What do you have planned, like, around your house? Are you doing anything? Are you like going through your lectures? Are you reading through papers, like dentistry wise, let's say?
To be honest, right now I've literally, because it's so soon since we closed, I've kind of been obviously primarily getting all my patients sorted out. So cancelling patients for the next 3 weeks, which, given that we have 7 surgeries, is quite a lot of patients. And my team's been amazing with helping with that. And then we're still running an emergency service, so we've got a few patients calling through on that basis. And then, to be honest with you, I've been trying to close down as many outgoings as I can do that would be present in the normal day-to-day running of the practice.
Right.
Because we're still waiting to see what the government can offer for self-employed people. But apart from that, yeah, I mean, definitely there's, to be honest with you, I've been meaning to do a lot more TikTok content for a long time.
Okay.
on like a dental basis.
Yeah.
Again, because I watch Gary Vee all the time, I've been looking at getting involved with that. So I'm gonna do a lot more videos. Do a lot more, maybe some YouTube stuff, like some longer form content on dental procedures, because I did one video on icon white spot treatment. And it was, I mean, I did it on iMovie like 5 years ago, and it's had like 150,000 views. And
no way.
If I had time to do more of these, I think they're actually quite valuable for patients. But yeah, I just haven't had time. And then I mean, I've got some lectures coming up at the end of the year. Oh well, they were due to be in May, but they're now going to be at the end of the year. I hadn't written those yet, so I've got those to write up as well. But yeah, to be honest with you, mate, I never get time to sit down and actually like read papers. Like Marcus Blatz, for example, posted that paper that he wrote the other day.
Gambarina,
I just quickly sort of scanned through it, and I was like, oh, this looks wicked. Like, I really want to tuck into this. And normally I would just sort of save it on my phone as a PDF or something, and then not have time to get around to looking at it. So
I actually read the article too, because I'm the same way. I'll save it as a PDF. I'll put it into my my iBooks, and then I usually read that when I'm on a plane. I go through, I don't have internet. What can I look at? And I'm like, So but I was able to look into that. And for those of you that don't know what we're talking about, it's a new article with Marcus Blatz and Iñaki Gambarina talking about best practices for anterior immediate implant placement and restoration as well.
So that's I'm looking forward to that. I'm looking forward to geeking out on some dental stuff.
we have the time. You know, one thing to go back to when we were talking about what Bill Gates said, all of those, 10 things or whatever he talked about.
Is that real, by the way, as well? Because I mean, there's been so much fake news that whenever everything seems really good, it's like, I like Bill Gates and I like what he's saying. Is this real?
So he did a thing on Reddit that was real.
Okay.
But I don't think the stuff that we got was from that. So
really?
I'm not sure, but either way, it's good.
It was nice.
It was nice. It made me feel good. It made me feel like it's nice. I'm glad that it's spreading, actually. That's a good thing to be spreading across the world. But one of the points in there was something that I often talk about, which is separating our profession from our purpose in life. And he said something like, it allows you to focus on the things that are important and realize that what we do is not, I can't remember what the word, what we do is not who we are, something like that. And that's so important for dentists. And the reason why I like to talk about that is because oftentimes we think our purpose is our profession, and not just dentists, but everybody can be like that. But especially with dentists, like we love dentistry, that's all we want to talk about. It's what we want to do. But then when something happens with our dentistry, a complication, let's say, we take it as something is wrong with our purpose in life. And maybe I'm not,
not
made out to be this person, right? And it just destroys us internally. And so why I always talk about that, and I'm happy that it was on that thing that, let's say, Bill Gates sent out is that more people will be talking about this.
Yeah.
Because I went through this to where I thought my purpose in life was to be a dentist, right? I was going to help people with dentists. I was going to make them smile. But then, you know, I had complications like everybody does. And my self-esteem was like, went down so fast because I only thought of myself in that way. And so like what I talk about now is when you meet somebody, whether it's like in a plane or at a party or something, and they say like, well, tell me about yourself. Usually we always start with our profession, right? We say, well, I'm a dentist.
Yeah.
But now I like to really think about who I am is like, I'm a father, you know, I'm a husband, I'm a son, I'm a brother, and I happen to be a dentist, or my profession is dentistry.
Yeah.
And I think that's super important to
it's an interesting
separate
personality
those.
change. Yeah.
Yeah.
Do you think you've been able to do that more since you became a dad?
For sure. 100%.
Me too.
And it also like my kind of mental breakdown came right before I had my son too. So it was almost like happening at the same time. Well, I was going through all these problems with certain patients, and I was stressed out in my practice, and it was too much. And then my son was born as well, and I really realized what was important.
Yeah.
And then that's when I could truly separate, and that's when I could like focus on trying to be home as much as I could. And in no way did it affect my relationship with my patients in a negative way. If anything, I think it got better.
Yeah, because you actually are not worrying about the failures before they happen. I mean,
exactly, yeah. And I'm telling them more about it before they happen.
Yeah.
Instead of like, what do they say? Like, if you tell, there's some expression like if you tell them
before, and it's a warning.
It's a warning. It's an excuse, right? Yeah, and totally true. And I was always
100%.
I was always in the excuse category, right?
Yeah.
I was like, oh, well, this happened, I guess, because, but now I like to talk to my patients and say, you know, this could fail, this may chip, this may do this, you may have pain, you may have swelling.
I'm a positive guy in general, but to my
Same.
patients,
I'm the same
before
way.
they have treatment, I'm probably the most negative individual you've ever met.
Me too.
I literally go to town on every possible complication.
Yeah.
And I think, to be honest with you, it gives you such freedom because things will fail 100%. And it's the biggest advice I could give to young dentists who are worrying about things failing is to be as negative as you can be beforehand. Now, some patients won't listen to you.
Yeah.
And they'll swear blind that you didn't tell them about that. But I think that's been really, really helpful for me. But yeah, it's interesting that because it's exactly the same pathway that I've had. I think since I've been a father, it's made my relationship with dentistry much better. And I think I feel a lot more relaxed. About the whole situation. I mean, there's still obviously you still worry when things go wrong. You've got a fan here.
One of my patients is commenting. Yeah, that's great. I love that. Having children definitely changes you and gives you the right perspective. And it's so funny because people always say like you don't really know until you have kids, and I was like, oh no, really, like I know, and then you don't. It's so annoying that it's so true like that.
Absolutely.
To have,
so you're getting more time now to focus on Pearl stuff and that sort of stuff.
I am, yeah. You know, with Pearl, I was, you know, doing a few days a week kind of thing.
Do you want to just tell everyone what it is, just in case any of my followers?
So I have an artificial intelligence company for dentistry. We automate things, everything from like intraoral scans on automated margin marking to reading dental radiographs with AI, all based on something called computer vision. And now that, you know, I'm not doing anything clinical and I'm not doing anything with lecturing, except for online stuff like this, I definitely have more time to focus on that, which is great because we're busy. And it's nice that business can still happen in the background.
Yeah, absolutely. Well, that's the key. I mean, that's kind of one of the reasons that I set up Parlor, was because I want to be able to diversify so that I can enjoy all the best bits of being a dentist and running my own practice. But heaven forbid I fall off my bike and smash up my arm, then at least I know that I can carry on supporting my family and everything like that.
Yeah, it's so true. I think it's every dentist's dream to have some type of passive income, right?
Yeah.
Because for us, it's like unless you're working on a patient or you have, let's say, associates, your office is open, even if you're just the owner, you're not making money.
Yeah,
And I
absolutely.
remember someone telling me a story about, I think it was Tony Robbins, and Tony Robbins was going skiing with somebody and they were going up the slopes, and when they got off, Tony Robbins was talking to the guy about something. I guess they were friends, and said, you know, while we were on the slopes, I made X amount of money. And most dentists, we don't have that option. You know, that's
Yeah,
how my dad
absolutely.
was. When we went on family vacation, his office was closed. You know, his
Yeah.
staff didn't make money, he didn't make money, and that's a big opportunity cost
Have you
for
read
us.
Rich Dad Poor Dad?
I have. Yeah, I
Yeah.
read it when I was in my residency in Brazil.
When I read that, I was like, I'm poor dad unless I sort it out.
Yeah, yeah. No, for sure. I think most of us dentists are poor dad. It
Yeah.
is, we work with our hands. While we're working, we make money. And we can make a decent living while we do
Yeah,
that.
absolutely.
But it's at a big risk. Like you said, if you get hurt, if you know, whatever, if you can't do dentistry, then we're kind of screwed.
Yeah, absolutely. So where are you guys
So
at with Pearl then? Is it spreading out? Is it available for dentists in the States to use the software
So
you have?
we are up and running in a few different categories. So like the dental insurance category, we are in the lab space, and we're also doing something called practice intelligence, which is analyzing people's radiographs on a bigger level, like especially for multi-practices, and
Yeah.
seeing patient populations and what's happening. Oh, my dad just signed on. Hey, Dad. And with our forward-facing digital analysis on radiographs,
Yeah.
we're in the process of getting our FDA approval.
Okay, cool.
So
Bet
we
that's
should
hard.
have that. It's a pain in the ass,
Yeah.
but we're pretty hopeful on it, and we should have it, you know, by next quarter. And so everything
Nice.
should be rolling out to
Perfect.
everybody. So yeah, it's an exciting time. And
Mate, I honestly think that is going to change dentistry so much for the better. Oh, there's my
yeah,
mum. My mum and your dad are in competition.
yeah, that's great. Family
At
support.
least we've got two fans, hey?
That's right. This is what's important. Yeah, this is what's important.
But yeah, I mean,
I think,
I just think it has the capability to remove all of the distrust that there is for dentists in the diagnosis that you're making, which I think is such a barrier between patients and
yeah,
dentists. And if you can have a readout that literally says this is it, there's no ambiguity about it at all.
yeah, yeah,
It immediately makes it a much cleaner scenario, and that's
right.
just the start. I mean, it goes, I'm sure, even bigger from
Yeah,
there.
going back to the mental health topic, right? And we're stressed out. You know, no dentist, we don't want to sell anything to our patients, right? We want to tell them like, this is what you need. And they say, okay, doctor, and here's my credit card, right?
Yeah,
But unfortunately, that's just not the case. And oftentimes they come to me, they come to you, they go to him and her offices because they want to get all these second opinions. So I think with AI, you know, not just what we're doing, but with any type of AI, bringing that in, it brings a true standard of care to our profession to where our patients
yeah,
can feel more comfortable. And so like the standard of care can be coming from the labs, you know, the digital aspect of marking the margin can be done all the same in any lab around the world. Or x-ray analysis can be done the same anywhere around the world. You know, the treatment may still change because you may have a different ideology than I do, or we were trained different, or we use different materials, but the
yeah,
diagnosis should be the same, right?
yeah,
And
absolutely. And
having, I
I
think
guess
that's
that's
how
just
AI is
gonna.
going to change things.
I think it's gonna level everyone up. It's gonna bring the base level up
Yeah,
to a net higher position, and then yeah, you're obviously always going to have differentials in various different areas, but it's just going to make dentistry better, I think, as a whole. So it's really exciting.
yeah. I had a professor in dental school that said there's multiple treatments, but there's only one diagnosis, and I
Yeah,
think that's so true.
that's a
And
good line.
the difficult part is that you know, a patient may come to me and I tell them they have 2 cavities, and they go to you and you tell them they have 1 cavity.
Yeah.
And we could both really be right in some way, shape, or form, you
Depends
know?
on what your definition is.
Yeah, depends on what your definition is, right? Did it cross the DEJ? Are you treating incipient lesions, et cetera, et cetera? Again, that kind of goes off of the treatment. And I think the difference with dentistry and medicine is that medicine, at least in the US, they use diagnosis codes, right? So they chart everything when there's a diagnosis. And in
Right.
dentistry, oftentimes we only do treatment codes.
Yeah.
So we're only like, I don't care what it is, this is the treatment for it.
Yeah, it's like you
And
need
really
to
we need to focus.
not you have decay.
Exactly, right. Right. And so I
Yeah.
think that if that can be adopted in our profession, that would really help build trust with our patients. And by building trust, we're going to have less stress in our life.
Yeah.
By having AI help us in every way, again, not just what we're doing, but in every way, whether it's calls or charting or anything, we can focus on what we like to do best, I think, which is actually treating patients.
Yeah, absolutely.
And this
Nice.
was why
Super
I
exciting.
was kind of passionate about it, was because I felt like I could also decrease the risk of our profession too.
Yeah, it links your other passion for mental health
Yeah,
and dentistry.
right. Yeah,
Absolutely.
yeah.
Absolutely. That's super exciting.
So I know that you've gotten good feedback about talking about mental health, and I have as well. How do you think we can help spread the word more? How do you think we can make this, like on my last Instagram Live, I was talking about how I think it should be a requirement. You know, like every 2 years in the US, we have to do 50 continuing education units.
Yeah.
I would love if it was a requirement that, you know, 2 of those units, 2 of those hours had to be around mental health of some type.
Yeah, absolutely. I think the key thing is we need, I'm sure you feel the same. It's amazing every time you put anything up about mental health. It's probably the thing that gets the most
Exactly
feedback
right.
from dentists.
Yeah,
But always in a direct message form, always in a private message.
totally.
Because people are still nervous about talking about these things out loud.
It's a taboo subject, yeah.
So I guess we need to try and develop a movement that allows people to vocalize it clearer. I mean, it'd be great to see something along the lines of a conference or a set of seminars focusing on it.
Right.
I think I definitely think that's something that we could put together.
Yeah.
But yeah, I don't know.
You know,
I guess we've got to just work with where we are in society. I think that's the thing. We run alongside the general population, and I guess it depends on where they're at with it as to how far people are willing to go.
Yeah, that's true. It's this taboo subject that no one wants to talk about. But going back to what you just said, you said whenever you post something about mental health, that's when you get the most reactions, right? That's when you get the most feedback or interaction. The same thing just happened to me, right? I posted something that I was going to be speaking at the Academy of Osseointegration about mental health, right? And I got more comments and DMs, like you said, likes, everything on that than almost anything I've ever done.
Yeah.
And so what would be nice is if the companies, or let's say the dental societies or groups or something, realize that. Because ultimately, a lot of this comes down to money, right? People don't want to pay for our travel to go travel to a symposium if we're not going to sell implants or CEREC blocks or, you know, whatever it is. If we're selling health, they don't make any money. So
absolutely,
it's like we need to figure out a way for somebody to make money, not us, but somebody to make money by this topic. And that's how.
Do you know anyone
what's so sad about this?
Because I've been flogging Headspace for years.
that would be a good thing. Yeah, we get Headspace to to kind of sponsor something. Well, you know, think of how many lives we could change in dentistry by getting people to start thinking about this. And
Not just change, mate, save. I mean,
save, yeah, it's so
like,
true.
It's one of the only ways that we can save lives in dentistry.
Right, yeah. We joke like we save lives, right? We save smiles,
Yeah.
I think, but
Yeah. On a good
maybe the
day.
oral surgeons save lives.
Yeah. But I mean,
Yeah,
I think it
it's
is.
totally true.
I don't know if it's still true that dentistry holds the highest suicide rate of any profession, but
Yeah, one
it's
of the
certainly
highest.
it's certainly one of the highest.
One of the highest. It
And
changes kind of every year. I know
yeah,
that there's about 3 professions that are usually at the top every year, but we're always in the top. I mean,
yeah.
definitely the top 3.
And yet
There's
we just
one.
whenever we say that, Megan's telling me it's top 5 now.
Oh, okay.
Whenever we say that, we kind of just shrug it off, like, oh yeah,
Yeah.
obviously,
Yeah.
just like it's kind of expected. But there are real dentists taking their own lives for a variety of reasons.
Every time I post about this, I get messages of like, "Thanks for talking about this," because my friend, my colleague, just committed suicide. I had a friend that told me after I posted that one about AO, his dad committed suicide. It's my friend from Brazil, and who is a dentist, and he's a dentist also, and it's wild that we can't talk about this. And there's still this, like, I think in the past, let's say decades, when our parents' ages were dentists, more men than women, and so there was this kind of machismo. I'm too tough to have depression, or I'm too tough to have stress, right? I'll just grit my teeth and get through it.
Yeah,
but
man up being the
man up, right?
Saying.
Right. And now I think one of the many great things about having so many women in dentistry, I think, is that maybe women are better at talking about their emotions, and they can kind of bring this to the forefront. So hopefully we can call on some of our female colleagues to talk about this as well.
Absolutely. I know my co-founder of Parlor, Rona, she's spoken to me about it before, so she would definitely be a great speaker on that topic.
Yeah, we should get her involved. I think we need the most famous dentists in the world to talk about this, right?
Yeah.
Because that, I think, is what really makes it real. Because then they're like, oh, he or she, is speaking at the best conferences, and they have an amazing practice and XXX, but they're still human, right?
Yeah.
They still have these human problems that we all go through.
Yeah, absolutely. And I think the problem is that people view it as a weakness. People who are successful may think that talking about their mental health issues exposes the chink in their armor, which is going to reveal the fact that they are not as good as people think they are, or not perfect, or whatever. But as you say, I mean, everyone's human. Everyone has failures. Everyone has weaknesses. Mm-hmm. And the more you get to meet your idols, the more not that it's a bad thing. They'll reveal their weaknesses to you, and it's an eye-opening experience. And those are actually, I think, the strongest people. Like, if you can actually vocalize your own weakness, then you're not actually trying to hide anything, which actually makes you stronger.
Yeah, I said this on my Instagram live a few days ago, but one of my mentors, Sasha Jovanovic, told me, "I failed more than you've even tried." Yeah, I was like, "Whoa, that's wild," because I've tried a lot,
Yeah.
And so to hear that from him, who again is like successful and famous in the dental world, and has instruments named after him and this and that, like, really meant a lot to me, and kind of brought him down to the same human level. No matter where we are in our careers, no matter how many Instagram followers we have, we're all human. We all make mistakes, and at a time like this is what everyone needs to be talking about.
Absolutely. So, I mean, how are you doing mental health wise since being at home? Like, are you finding it hard? I mean, obviously you are.
At first it was really difficult because I was so concerned about money. But then when I was able to defer my loans, I'm feeling great actually. Like
Oh, that's good.
when you take the money aspect out of it, you know, at first I was like,
Yeah.
I'm gonna go bankrupt. I'm not gonna be able to pay my mortgage. Like my
Yeah.
credit score is gonna tank. But now, since that is kind of off the table, I'm like better than I've ever been. Like you said, I'm
That's
relaxed.
pretty
I'm
good.
exercising. I'm eating well. I'm having plenty of family time. I'm getting a lot of work done. I'm being very productive as well. I'm
Yeah.
sleeping well. I mean, like I said, besides the doom and gloom, I kind of like this reset.
Yeah.
I feel like we should do this once a year.
I literally said to Megan like 2 months ago, I was like, Megs, what do you think of a 6-week mini retirement? Like next
Right?
year. She was
Yeah.
like, no, you can do one.
Yeah. And I think another
But
thing, you know, going into like what you guys are doing with Parlo, which I think is so cool, is all of the great things that are coming out of this for the world, right? For the earth.
yeah,
You
I mean,
see
if you
these
look at
things about, you know,
the
the
pollution,
dolphins in Venice and,
yeah,
you know, the air pollution. I looked on my weather app the other day and it said the air quality was good in LA. I've never seen it say good. It either
really
says like average or unhealthy or like
catastrophic.
don't go outside, you're
Yeah,
crazy for living here. Yeah.
yeah,
So I mean that's great. I think the earth needs this reset sometimes.
yeah. Yeah. As I say, I mean, there's definitely. I think for the human race, I think it's certainly opened our eyes to a lot of the bad activities that we've been carrying out.
Yeah, what's important in life, what we've been doing to the earth, right?
Yeah.
How
Yeah.
has on that topic, how's Parlor been going?
Parlour's been great. Yeah, I mean, it's obviously not a great time to launch a startup business in a
Or
global
any
recession.
business, yeah.
But apart from that, no, it's been epic. I mean, we've had a really great pre-launch and launch.
Yep.
We've had loads of support from the profession around the world, which is amazing.
I see you guys have been
Um,
written up a few times already. Very cool.
yeah, we've been in GQ. We've been in
Wow.
a couple of sort of newspapers and sort of women's beauty magazines in the UK. We've got in the, like coming up in the Times and a few other papers. So that's really
Super
exciting.
cool.
Yeah, I mean it's always going to be a slow burner because we're asking people to change a habit of a lifetime, which is
Yeah.
using traditional toothpaste.
Yeah.
But the feedback from the actual sort of usability of the product's been wicked. It's slightly different because it doesn't foam as much because you don't have the foaming agent which comes from
Right.
palm oil.
Yeah.
Um,
I never
but
realized that came from palm oil until you
yeah,
guys, so that's really good
I
to
know,
know.
nor did I.
Yeah.
Once you sort of get used to that, it's really easy. It's it's really exciting. We're really feeling really positive about it.
Yeah, I
And
have to
I
say,
mean, it can make a massive impact. I mean, if we can get even a small percentage of the population, even of the UK, to start using it, it's gonna. I mean,
think of how
1.5
much
billion
that will
tubes a
save.
year goes into landfill. It's mental.
Wow. Yeah, no, it's really cool to
And
see
those
you
little,
guys
little
doing that.
tubes that they're in the States, they give you the little tubes that you just
Yeah.
like give out to your patients like candy.
Yeah. Yep.
Those like last like a week or two max, and then
Right.
they're in the bin.
Yeah,
So
those were like what I always used because I was always traveling, you
traveling.
know, and it was like easy to just grab some from my office. And then,
Yeah,
you know,
exactly.
you guys kind of opened my eyes and I was like, oh, okay, this has got to
Yeah, for sure.
change.
So,
Yeah.
mate, in the States, how's your healthcare system holding up with all the COVID cases? I imagine overwhelmed. Are
Yeah.
there any like charitable sort of resources that people can send money to or anything like that? Or
Not that I know of or that I can, you know, plug right here.
yeah,
I'm sure there are. I know that going back to Bill Gates, I know that he donated $100 million to ramp up some type of not merchandising, ramp up them making masks and ventilators and things. So hopefully that happens quickly. But I think that's the biggest concern right now are hospital beds
yeah,
and you know, protective equipment. And
Yeah.
from my friends that
I don't know,
are doctors
in
and
the UK, it's
nurses, they've told me the
ventilators.
same thing.
I
Yeah.
don't know.
Well, have you seen the dentists that are, some of my friends here in LA are actually printing on their 3D printers,
Yeah, I think
ventilators,
as my friend
and
Adam Nolte started that.
yeah, super, super cool. So anybody who can contribute to that,
Is that actually functioning though? Because I mean, I've got a couple of printers at the office. I know you do as well, but
I'm trying to find out if they're like finished with their design
yeah,
and what's happening, because
yeah,
I wanted to do the same thing.
that'd be wicked if we could help.
Yeah, I think that'd be, kind of a cool way of all of us, if you're home doing nothing and you have a 3D printer at your office, and, if you're allowed to go outside, that's the other
Yeah,
hard part maybe.
yeah,
You know, print 1 or 2 ventilators and you could save lives.
that's amazing.
And
Well, I mean,
that'd be
in the
pretty
UK,
cool.
some community dentists, one of them actually DM'd me today and asked me to shout her out, which I think is only fair. Lena, I think her name was.
Hmm.
They're being asked to go into the hospitals and basically act like doctors and sort of give drips and
Yeah.
injections and all sorts of things.
I could see that happening if it really gets bad.
Yeah,
Like they may call someone in, like me. I do anesthesia, so I put people to sleep. I can start IVs, surgery training. They may have me suturing people and giving IVs because the
normal
the
doctors
real
are
important
doing
doctors
COVID,
need to do the real important stuff, right?
yeah.
I mean, I think that would only happen if we're talking about really extreme measures.
Yeah,
But let's hope it doesn't get to that point.
yeah, for sure. Do
Yeah.
you
So
feel, does it feel like the curve is slowing down in the States? Is it?
I don't know about the numbers, but I think people are definitely taking this whole stay home thing very seriously now.
Yeah,
And like when I go on my street and look down both ways, I don't see, I mean, I maybe see one person walking a dog and one person running the other way, when usually there would be cars, and we live on a little bit of a busy street.
yeah,
So that's been nice, that I feel like people are finally not going out of their house and ordering everything on Amazon Fresh or
yeah.
HelloFresh or all of these meal
Yeah,
plan
they're
services.
Deliveroo's stock's going to be just going through the roof, isn't it?
They're killing it. Yeah, they're
Yeah.
killing it. Well, like one thing I'm concerned about is, on Amazon Fresh, we tried to order yesterday, and you basically have to sit there like you're ordering tickets for a concert and like refresh,
Right.
refresh
Yeah.
all throughout
Have
the
like
day.
5 laptops going.
Yes, to find a delivery time.
Yeah.
So that I'm concerned that it may get to a point where you can't get food. But
Well, at the moment we can't. Like we just ordered off some random sort of farm shop which had an online delivery.
because they were the only one available.
All of the big supermarkets you can't get an online delivery.
Yeah.
So
Yeah.
Megan's being very tight with my rations at the moment, unfortunately.
I did the same thing with my wife. I said, okay, you can have 3 crackers.
Yeah,
You get
exactly.
3 crackers. Yeah.
Yeah.
So we've got
Cool.
about 5 minutes left. What should we kind of finish up with? Any other final thoughts?
I don't know really. I mean, I guess what can we offer the most value with at the moment?
Well, I think the biggest, most important thing we can say is if anybody is struggling, stressed, needs someone to talk to, doesn't feel like they want to air their dirty laundry out, feel free to message either one of us.
Yeah, absolutely.
And this happened to me the last few days. I had a dentist from Canada message me and say, I'm really going through a hard time with this. This is my situation, and financially and this and that. And so it's nice to just have someone to talk to. And I'm happy to answer any messages like that.
Absolutely. More than happy. I think it's one of the best things that we can do. And
Yeah.
if someone wants to meet up and just chat about how they're feeling.
Virtually though, not in person. Stay
Yeah.
6 feet away.
Right now, I was going to say, go to the pub, have a beer.
Yeah, right. Maybe in a few months. But
Definitely
now
not
we can
that,
talk
but-
virtually.
Yeah. Well, that's the
Yeah, I
piece of
think
it,
I think that's the main thing we can do, is just kind of be there for our profession.
Yeah.
Continue to encourage our friends and our colleagues to talk about these hard issues.
Yeah.
And make this not a taboo subject, at least in dentistry, right? Maybe we can be the first profession that is openly talking about stress and depression and suicide.
Absolutely. Yeah, I think it's really important. And yeah, I mean, definitely I've had some serious ups and downs with the COVID crisis.
Yeah.
Emotionally already.
Emotionally,
and,
yeah.
and I know I always go on about it, but I have found meditation to be so powerful. It's honestly like a reset for me. Like if I'm getting myself in a real sort of a real stress about money or about whatever I'm doing at the time, it just really helps to re-clean the slate and refresh everything and actually put everything in perspective a lot better.
Yeah, completely agree.
Cool, man. All right,
well thanks for jumping on.
I know you got lots to be doing for the rest of the day. I'm gonna go to bed. It's way past my bedtime at 10 p.m.
That's right. Typical dad.
Yeah, exactly. And,
yeah, well, always good to catch up.
We'll have to do
this. We'll have to do this not on IG live sometime, or maybe we'll do another one live. Who knows?
Well, mate, I forgot to tell you. So obviously the MIS Global Symposium was pushed to October, I think.
Yeah.
So they invited me to that. So who knows? Maybe I'll be able to make that.
See you in Morocco then. Bring your family. Please bring your family so our wives and kids can hang out.
Yeah, that'd be wicked. That'd be epic.
All right, cool. Well, thanks everybody for your questions and comments and hearts and everything. And Simon, always good to talk to you, my friend.
Cool, man. All the best.
All right.
Stay safe.
See you guys later. Bye.
Bye.